Thank you very much, Madam Chair. Esteemed opponent, distinguished guests, ladies and gentlemen, as the proponent, I speak in support of this motion and will present my arguments according to the following definitions. Firstly, when we speak about students, we are speaking about students from high-income countries undertaking volunteer work in low to middle-income countries, for which the length of time and the specific scope can vary. Work can include, but is not limited to, direct service provision, research, education, and/or advocacy. Additionally, it can be argued that some experiences are more responsibly run than others, which has implications for how they affect stakeholders, particularly in host communities. Secondly, I choose to define justified as good, suggesting that the existence of these efforts is largely considered a good thing. Finally, I choose to define benefits as benefits accrued by any stakeholder involved in the phenomenon. This includes the students themselves, the organizations or institutions that send them, the home communities of these volunteers, and the communities abroad that receive these volunteers. Using these definitions, my arguments will demonstrate that when all the players of the phenomenon are considered, the conduct of student volunteering abroad is justified and the benefits overall outweigh the harms. I will also spend some time addressing a specific contention around the harms assumed by receiving communities, and will explain at length why this is a separate issue for another, more important debate. Tourism research finds that nearly 1.6 million volunteer tourists spend upwards of $2 billion worldwide annually. Specific to medical experiences, a 2008 publication by Harvard researchers estimated nearly $250 million spent on short-term medical experiences abroad. Factors driving the growth of this phenomenon extend beyond mere access to easy airline travel. In fact, many of the factors that have led to the growth of this phenomenon are related to the many benefits that are accrued by those involved. These benefits explain the growth to date and forecast continuing future interest in student efforts abroad. I will now present the benefits and harms experienced by each of the four groups of stakeholders I mentioned in the initial definition. Before doing so, however, I want to underline that one particular motivation for this phenomenon are our societal values of charity and altruism. For the large part, research shows that people go abroad wanting to help, and that their very intent is that their work benefits local communities without causing harm. I highlight this because it shows that the intrinsic motivation for those going is to ensure that the benefit-harm ratio sits well for the communities as much as it does for them, and this will become important in the separate contention that I address later on. Thus, considering who benefits, we know that students benefit largely. While participation is largely tied to those societal values that I mentioned before, secondary benefits include the opportunity to travel and experience new cultures, the opportunity to develop new skills in language, leadership, critical thinking, ethics, cultural competency, working in limited resource settings to develop better diagnostic acumen and be able to better make decisions under pressure, and also the opportunity to advance careers through developing networks with future professional collaborators, nonprofit organizations, and institutions abroad. Institutions and organizations similarly benefit by fulfilling a social justice mandate and are able to develop funding streams from grants, particularly for overseas research. They are able to attract and retain top candidates and faculty by offering such programs, and also to develop networks with top institutions while building their reputation. Considering the communities at home and abroad, the volunteers communities receive indirect benefits in that research shows that students are likely to continue volunteering when they return home. Medical students in particular are more likely to choose primary care specialties and to serve underserved communities over the course of their careers. And for communities abroad, such work is not entirely without merit either. After all, it provides access to partnerships, and under appropriate local direction, medical work can support local efforts, research projects can provide capacity for evaluation or data collection, they can help inform policy, teaching can support local providers and local population health efforts, and advocacy work can result in policy change, while visitors stimulate the local economy and support local jobs. And for these reasons, communities abroad sometimes even actively solicit student efforts. Now, considering the harms from the phenomenon, students encounter harms rarely. It is usually related to safety and security as well as communicable disease risks, which, for the most part, is no different from traveling elsewhere for pleasure. Institutions also rarely experience harms, unless they get bad press from an experience that goes dreadfully wrong. Oftentimes, home communities may have an indirect harm since students aren't volunteering at home, but of course this is offset by the long-term benefit that suggests that many participants are likely to serve marginalized and underserved groups when they return home. And this leaves communities abroad, and much contemporary criticism has arisen suggesting that these communities receive little benefit and assume a disproportionate risk of the harms arising from these experiences. As my opponent will likely elaborate, harms often described include a lack of continuity, cultural mismatch, imperial mindsets, students practicing out of scope, a power imbalance in interactions, possible coercion, and undermining of local leadership, as well as tying up local resources. Remember, however, that not all experiences are created equal. While some institutions may simply parachute in and shotgun through clinic after clinic on their own, others go to great lengths to prepare volunteers with pre-departure training, cultural sensitivity training, and ethics. They partner with local organizations, they work collaboratively, they privilege the opinion of local leadership rather than just starting efforts willy-nilly. Well-run efforts thus both maximize the likelihood that a locally identified priority will be addressed, which benefits the community abroad, and minimizes the intrusion or harm associated with some of the negatives that I have just described. Remember also that I highlighted that the motivation for many of the participants and stakeholders is that they truly want to do good. Focusing on the community abroad, if the intention of the visitors is to do good, shows that there are certain practices that achieve this goal better than others. Then contemporary discourse is essentially missing the point. The question really should be, how can we match good intentions to good outcomes? How do we ensure that benefits are consistently outweighing harms for the communities abroad? Thus, for the purposes of this debate, considering the definitions of benefits and harms that I have outlined, we can fairly argue that the benefits accrued by all parties, students, institutions, home communities, and communities abroad, outweigh the occasionally substantial harms assumed by receiving communities from poorly thought out experiences. We should also recognize that the benefits accrued by many of these parties also means that attempts to discourage participation to redress these harms are likely to fail. In other words, saying don't go is not a viable solution. Contemporary contention with student volunteer efforts must therefore shift away from should these occur to how should these occur. And as I highlighted when I began, this issue is entirely separate from the resolution at hand. That said, I also wish to address this contention as it is important. If not for optimistic reasons, to match good intentions to good outcomes, then we must address it for pragmatic reasons, recognizing that refusal to do so will do little to stem the growing interest in participating and will remove us from the conversation altogether. The educational community cannot sign out of student experiences. If we do, who will step in? Private enterprise and business comes to mind, having volunteers go with the highest bidder. And no, just because we recognize that something isn't living up to its potential now, doesn't mean we should stop doing it altogether. As an analogy, Ignaz Semmelweis, as many of you know, discovered that appropriate hand hygiene could reduce the rates of postoperative fever following obstetrical surgery. Semmelweis's contemporaries did not consistently observe sterile technique. Thus, while for the most part surgery had a good benefit to harm ratio, there were definitely patients for whom a lack of hygiene produced fatal and abysmal outcomes. Thanks to Semmelweis's advocacy, however, sterile technique became part of modern surgery. Today, it is rare for anyone to debate the benefit-harm ratio for essential, properly conducted surgery. We should therefore be glad that we didn't say stop doing surgeries when the real reason was that it wasn't living up to its potential because we weren't doing it well. In the same way, simply saying, it's bad now, don't go, abdicates our responsibility to optimize these experiences in a systematic, responsible manner. In a world with growing health needs, we should see volunteer experiences as a resource that is not living up to its full potential. Thus, within this separate contention that communities abroad assume harms from poorly conducted efforts, it is imperative that we craft guidelines and volunteer ecosystems that allow us to minimize harms and realize the potential of these efforts. To summarize, therefore, considering the resolution, the volunteers benefit largely and very rarely experience harms. Institutions also benefit largely and experience rare harms. Sending communities benefit with little to no harm. Communities also benefit abroad somewhat, but they also assume a number of harms, especially around poorly done or irresponsible volunteer work, which always has the potential to harm individual patients and/or health systems, regardless of where they're done. Thus, from an overall perspective considering all the stakeholders, the phenomenon's benefits largely outweigh its harms and is particularly justified if the volunteer work is properly conducted with an aim to minimize harms in the receiving community. The separate contention that receiving communities assume most of the harms highlights that some of these experiences fail to achieve their potential. I reiterate, however, that this is a different debate, and the real one that we should be having. How can we ensure that volunteering abroad is consistently done responsibly, rather than should we go at all? Madam Chair, esteemed opponent, ladies and gentlemen, I thank you for your attention.